Okay. Very good evening, everyone. Welcome from SNIC Rehab Foundation. I'm Harshali Kharche. I'm the founder and one of the director of SNIC Rehab Foundation. We are basically from Nagpur. We are coming up with various things in Nagpur. SNIC is Special Needs Integration Center. Our basic motto is to create awareness about various disabilities, sensitize the society about inclusion, acceptance, and various interventions. To establish a support system for the parents in various areas are very much important. I felt advocacy, emotional, mental health, child's development and their habitat and financial sector. Also, there is a need to sensitize the government personnel and eminent personality of the society about the challenges of special needs families, because they are not aware. If we make them aware, they take up the issues. That was I felt during this webinar time also. So here our motto is to educate the parent and develop their perspective towards the right kind of interventions and treatments. In Nagpur, we are coming up with various projects. They are coming up projects, not yet this thing. Recreational center, community support center, social rehabilitation, integration, vocational, daycare, residential home. Here are motto of this center is to provide a conductive environment for children with special needs so as to facilitate their development and help them into develop their fullest potential and enhance their independence and enable them a well adapted individual in society. So for this, we need to sensitize the society and we need to create some spaces physically. So now, today we are here uh, on the very essential topic, the social development of children with special needs. For this, we have with us Nishtha Budhiraja ma'am. She will talk about this topic. She is Nishtha, she is child psychologist and adult psychotherapist, a certified play and art therapist specializing in children with special needs. She is passionate about and trained neurodevelopmental disorder in India and UK. She is the co-founder of Samarthya Child Development Center and Psychological Services in Delhi. So Nishtha, I welcome you on this webinar. You can take over.
Thank you so much, ma'am.
I'll just stop sharing. Yeah.
Hello, everyone. I know it's evening time. Let's be a little proactive. And thank you all for coming. So, like Harshali ma'am said, that social development in children with special needs is something that's very, less talked about. We talk about intellectual development, cognitive development, motor development, speech, language, and communication development. But social development somehow, when we're discussing such topics, it tends to take a back seat because there are times where we don't even know what social development is or what social quotient is. And first and foremost, what I would like to tell all of you is that social development is directly correlated to intelligence quotient in a child. So there is a zero point 0.8 correlation, positive 0.8 correlation, which means that as and when the child socio-adaptively develops, the child's tendency will towards having more intellectual development also increases. So as and when the social development increases, the intellectual development also increases. So that's one of those things that we need to talk about and be very well aware of. One of the first and foremost things is that it is one of those indicators to diagnose or even and look at is in autism we do look at the social development of the child. So it becomes one of those hallmark symptoms that we look at. All right, I'm going to start sharing my screen, and we're going to change a little bit of the format this time. I am going to take the questions towards the end of today. All right.
There is background noise, fan or something.
All right. We'll be talking about we will be talking about social development in children with special needs. So, why is it important? It is important for language, for communication. It is important to get an understanding of what one's culture is. So, for example, in northern India, we touch the old elders' feet. Now, how do you learn this social behavior? You often learn this social behavior when you see your parents doing it, and you realize that it's something that's good. It's worth doing because everybody around us is doing it. It gives us an understanding of what the rules and regulations are there around. So something that's very basic is that we leave our slippers outside when we are going inside to pray at most of the religious places. So that's one of those rules and regulations that you learn or you comprehend or you actually get a sense of if if your social development is at the appropriate level. Then we get to know about the norms. So norms are the unspoken rules in the society. So, for example, everywhere there is a dress code when we go for different professions. So, for example, doctors are supposed to wear a white coat, lawyers are supposed to wear a black coat. When we go to religious places, some places, most places, our head needs to be covered. So, all of these are unspoken rules of the society. Social development is extremely important to learn values and behaviors. So these values can be hard work, these values can be being on time, punctuality, or these can be, different behaviors like being able to make effective communication, be able to manage your time well. And then of course there is how you learn social skills. So how do you communicate with people in a two-way conversation? Do you use conversation starters? Do you use conversation enders? What your body language has to be like? So all of this comes under part of why we require social development, or why is it important in our lives, and why do we really need to understand this right now. The most important social skills that are out there, there will be n number of them. I have just picked up the ones that I mostly work with in children, and once we've achieved all of these, getting the rest of them becomes slightly easier. Or the kid also tries and understand that, listen, this is my limitation, this is as far as I can go, so I'll use my strength to cover up my limitations. So the most important social skill is trust. Then there is empathy. A lot of times I've heard a lot of parents say that, our child doesn't understand that they have hurt us. Um, and that's where empathy comes into play. You might have seen children who are non-verbal or who have low comprehension skills, that they tend to laugh at the most inappropriate times. Sometimes it's something that's very biological, very neurological. Sometimes it is that lack of social skills. It depends on the diagnosis, it depends on the situation, it depends on the behavior of the child, and it also sometimes depends on the exposure level of the child. Then there is acceptance of your own self, acceptance of other people, acceptance of the things that are happening and the changes that are happening. Communication, one of the first and foremost important skill as parents. I get to hear, when will our child start speaking? I mean, I'm dying to hear my child talk to me in a full sentence. And that's something that brings to my notice that it is extremely important social skill for a parent, that communication needs to be there. Then there is cooperation. So cooperation in terms of that, if you're cleaning the child's room, the child is not making it dirty as you clean, so that it's impossible for you to actually clean. So you do need some level of cooperation from the child. Another thing is something that Harshali ma'am was just discussing, that children need your attention at when it's the most inconvenient for you. And this is something that even my mother has told me, that as a newborn baby, or as a 1 year old child, I used to demand her attention at the most inappropriate time. So every time she would sit down to eat, that would be the time that I would actually have wet my diaper, and she would have to stop her food, change my diaper, change my clothes, wash me up, and then get back to her food. So that's where children require that level of cooperation with their parents, and it's an important skill. It's a very essential skill for a child's development and future friendships as well. And
Yes,
of
ma'am, I
course,
just interrupt you. There is lot of background noises coming.
just give me a second. I'll switch off my fan. I think it's probably the fan.
And the window is, I think, open. So I don't know. A lot of noise is coming.
I'm not sure. I think it's probably the fan. Give me just a
Okay,
second.
okay.
I'll
Sure, sure.
Is it better now?
Yeah, yes.
Yeah, it was the exhaust fan that was switched on.
Yes, yes.
Okay. All right. Great. Yeah. So emotional regulation, we've already done an entire webinar on emotional regulation and how essential it is. Just to briefly touch upon it, so you would require emotional regulation as parents and even as children, to be able to understand your own emotions, to be able to comprehend how to calm yourself down, to be able to look at the other person and assume or infer or interpret their emotional state, and work accordingly. All right, I hope it's clear till now. If you have any questions, I'll take all of them at the end. You can choose to put them in the chat box, but we'll take them towards the end, okay? Or you can just write them down, but I'll answer everything towards the end. All right. So I have just briefly put down the process of learning social skills in a neurotypical child. Very briefly, this is not an exhaustive list. And as a clinician, I will not give you the exhaustive list. Not because I have any hidden agenda, because it's from a test that we use with children, and giving that out sort of compromises the standardization of the test. So this is something that's purely ethical, and I could get into a lot of trouble. So I'm just using it as a benchmark to make you understand that this is the natural progression of social development in the major areas that a child goes through as the child grows up. All right. At about 0 to 1 years, they're able to follow simple instruction. So when there's a child that's born, we call their name, we click our fingers, and the child looks in that direction. We call their name, they respond. So that will be following simple instructions. So if there's a child has been called from far away in the room, the child will actually look in that direction. So the child is able to follow simple instructions. At 1 to 2, they are able to play with other children. You've seen with your kids that if you put two kids around this age, 1 to 2 years, in the room with toys, they're able to play, not cooperatively, not together, but maybe simultaneously or parallelly for that matter. From 1 to 2 years, they also start talking in simple sentences. So they'll join two words: "Khana de do," "Bahar chal," "fan on," "open close." So things like that. Simple sentences, 2 to 3 words they'll join in. They'll say till about 2 years. Then from 2 to 3 years, this is the time when they start going either in early play school, or they go in crutches, or they start getting introduced to books and stories. So they're able to relate experience and narrate them in the form of stories. So you might have seen some neurotypical children around 2.5, quarter to 3 years old. They start talking and they don't stop. We went there, we did this, we ate this. It had a lot of spice in it. Then I had a chocolate, then I had an ice cream. Then I went for a camel ride. Then, there were so many things. Then I got really tired and I slept off. So that's how they relate experiences and narrate them in the form of stories. Then at the 3 to 4 year level, they're able to play cooperatively at kindergarten level. So that's the time when the kid starts going into a play school. Sometimes 4 and a half, they will start going to formal school as well. So here we look at whether the child has attained the social skill at around almost the same age. And then at 3 to 4, we also see that they start performing for others. So if you ask them, okay, can you, recite a nursery rhyme? So they're able to do it. If they're shy, it's something that we say that it's a personality trait. We don't consider it as that the child cannot do it. However, if the child is socially anxious, then that's where something of this sort needs to be worked at. Okay. Then the next one is goes around the neighborhood unattended at about 4 to 5 years. And now I'm sure as parents you would have a safety concern. What we mean by this is they can just go out in the front yard or your backyard unattended. They can roam about in the house freely. Maybe go to a neighbor whom you know really well. Just be like, okay, unattended means you don't have to hold their hand and take them there. You can just supervise, maybe just look at them going to the next door neighbor, and they can go about doing their business. Then at 5 to 6 years old, they begin to play simple games. So these simple games mostly are house, doctor. You would see a lot of kids, playing with kitchen sets, making food, and trying to emulate their parents, trying to emulate certain things that they've seen around. Then 6 to 7 years, they're able to go to bed unassisted. So mom says, listen, it's 10 o'clock, 10:30. It's time for bed. Now change your clothes and we go to bed. All right, mom, help me change my clothes. Okay. And then they tuck themselves in bed, switch off the lights, and they sleep. And from 7 to 8 years, they engage in pre-adolescent play. Now, this is where a lot of social issues come about in our awareness, that you would see certain behaviors that the child is not able to wait for their turn. They're not able to wait in a line. They don't understand rules and regulations of games. And as a result of that, a lot of behavioral and emotional problems do come about, even in neurotypical children. And the list basically goes on till about 14, 15. Okay. So now, after looking at all of these important developmental milestones, you would ask me, what needs intervention? Nishtha, how would we know when to take our child to see someone and get an intervention, or maybe see someone and see whether there is something that needs to be intervened, or should we just have a wait and watch approach? If there is a delay of more than 6 months in acquiring any social milestone, it needs to be assessed. And by that, I mean get it assessed either from a clinical psychologist, a child psychologist, or a developmental pediatrician. Most pediatricians are concerned about the physical side of things, the physical functioning of things. The developmental part of it is mostly handled by a developmental pediatrician. They are the ones that take practically anything and everything into account: behavior, milestones, any sort of a brain injury. So they keep everything in the loop, and that's how they assess, keeping every domain in mind. That's why it's important to take your child to them. Sometimes some other therapists can also help in the assessment. So maybe an occupational therapist, maybe a speech therapist, maybe a special educator. Also, therapists tend to be experts and masters of their field. They'll be able to assess and tell you, listen, this is where the problem is according to me, and this is how we can go about things. Uh, it may not be an exhaustive assessment of all the areas. So go for an exhaustive assessment of all areas. See, just do whatever you feel is in the best interest of your child and not the society. Again, I would probably say this a number of times today as well, that do what's in the best interest for you and your child. All right, now talking about children with special needs and their social development, and this is one of those areas where kids have a difficulty in understanding or a difficulty in with their social skills, and why do we need to take all of these into consideration? Because I've just covered a few of them. It's because we need to look at two things. One is whether there is a social development that is lagging behind. Two, because of special needs of a child, is the social development being affected? So in the first case, it's a primary cause of concern. It is the major problem. In the second one, it's the byproduct of a major problem. Irrespective, both cases, it needs to be intervened. So the first one is autism. We all very well aware of it. Social communication problems, and there is a lack in social emotional reciprocity. And autism is something that's very beautifully exhibited in a lot of Hollywood and Bollywood movies. So there is a lack in having a two-way conversation, a lack in understanding the rules and regulations of communication and language. If we are smiling towards a child with severe autism, they may not be able to understand, comprehend, and smile back. So that emotional reciprocity is also lacking in social setups. Second one is ADHD. A lot of parents, a lot of clinicians, a lot of doctors um, tend to ignore ADHD from lack in social development. Now, what really happens in ADHD is that the child has a very short attention span, the child is hyperactive, the child is restless and impulsive. So, because of all of these four things, what usually happens is that they have a difficulty in understanding and following social rules. They have difficulty comprehending what is expected out of them. They have a difficulty in internalizing these rules. They have a difficulty in regulating their emotions. They have a difficulty in regulating their communication as well. For example, if I'm driving on the street and somebody cuts me off wrong, and I get really irritated. Okay, so but that's not going to be like that. I'm going to leave my car and I'm going to go over to that person and give him a piece of my mind. I understand that it's something that's very unsafe, and it's something that's very normal and natural that happens. People do cut other people off in traffic, and as a result of that, so this is the normal natural order of things. um, if I was someone who had ADHD, I would not be able to curb my impulsivity, and I would actually go ahead and give them a piece of my mind. I would verbally abuse, I would fight. And I'm not saying that every child with ADHD will have this problem, but this is something that they really struggle with regulation. So it is a cause of concern. The child is fighting a battle on the inside that you and me are probably not even aware of. So again, I would say the same thing that I did in the last webinar: a little bit of sensitivity, empathy, and support for these kids, for that matter, for anyone else. Okay. Also, kids with ADHD become big bullies, and they are bullied also. Happens both ways. Then there is learning disability, and this is where I've seen so many parents, so many clinicians not focus on the social development. um, it's just a learning disability. It's fine if the child cannot dress themselves. We're there to help, we're there to assist, but that pulls the child's confidence down, that they are socially not being able to take care of themselves, that they need someone to supervise or assist them. It pulls their self-worth, it pulls their confidence really down. And also their visual spatial issues are there, so they're not able to gauge how much time it's going to take, how much effort is going to take to execute a task, um, how can I manipulate my body to go from one space to the other. Tying laces becomes a difficulty, sometimes even drawing mirror images becomes a difficulty. And all of these things bring about bullying, and there is a huge difficulty in making friends and relating to others, because they are the ones who are so in submissive is not the right, introverted rather, they become so introverted that it becomes really difficult for them to open up, because nobody tends to understand them. On the outside they don't really look like children with special needs in the categoric sense. So a lot of times parents, teachers, educators also say that they're faking. It's not something that that is a problem, they're just faking. And this sort of brings me to this scene from Tare Zameen Par, where the father says in front of Amir Khan that मेरा बच्चा आलसी है, वो सिर्फ मेहनत नहीं करना चाहता. And Amir Khan uses the same terminology and he gives him something to read in Chinese or Korean. And he says, आप मेहनत नहीं कर रहे हो, आप मेहनत करोगे तो आपको समझ में आ जाएगा. And he says कि ये तो चाइनीज में लिखा है, मुझे कैसे समझ में आएगा. एंड दैट्स व्हेन आमिर खान सेज उसको भी सारे इंग्लिश के लेटर्स, उसको भी हिंदी के लेटर्स चाइनीज ही लगते हैं, तो उसे कैसे समझ में आएगा. So that's where empathy goes a long way. It doesn't mean that we give the child relaxation, that you're exempted from doing X and Y, X Y Z task, but we teach them to be self-dependent, and that's where therapy goes a long way. We are also trained and we are also taught how to make the child independent of therapists and therapy. That's the ultimate goal, and I say this from personal and professional experience, that um, the day a child's training wheels comes off, and the day they stop going to therapy, and they come back and they say, thank you so much ma'am, or thank you so much didi, it fills me with so much joy for that child and pride towards that child and the parents. That's what we're aiming at. The child be self-dependent to the best of the child's ability in every possible domain, not neglecting the social domain. All right, moving on. Cerebral palsy. So there are movement, speech, and communication issues, and it brings about a lot of difficulty in forming relationships, a lot of difficulty in understanding what the rules and regulation of interaction are. Sorry. Um, it brings about a huge amount of difficulty when they have to execute social behaviors that you and me take so easily for granted. Issues like not interrupting people while talking, issues like waiting in line for your turn, issues like impulse control. Um, we take all of these things for granted, that we can just run around, wait in line, and buy whatever we want to buy, calculate everything. These kids struggle with that in every possible domain, because there's movement issues, physical and communication development problem, communication and speech issues, and a lot of times with cerebral palsy also comes certain level of intellectual deficit or a cognitive deficit. So these kids have a really difficult time. Then there is Down syndrome. Down syndrome is something that's especially very close to my heart. It's one of those um, areas where I absolutely love working. So speech and language pathologies and comprehension problems are there, and it makes it very difficult for them to exist in the social world. One of the major reasons where their difficulty is that they actually, in the conventional sense, they have those physical features of having downs that come with having downs: the almond-shaped eyes, the peculiar nose bridge, the tongue, the drooling, and everything, um, and the face to body ratio and things like that. These are physical markers that bring about labeling as well. And once the child feels labeled, feels different, feels that I'm not normal, their social development takes a back seat. Their emotions tend to cloud their development, and I've seen them cry without howling, without verbalizing because they cannot. I've seen them cry quite a lot, and it's not a very happy sight to see any child cry, irrespective of their diagnosis, just because of the labeling. And labeling is one of those things that does bring down a child's social development, irrespective of whether there is a diagnosis, there is not a diagnosis, there are special needs or not. You label any person, it'll pull their confidence down, it'll take their social development for a toss. You'll see a lot of regression as well. They'll retract back to a previous form of being. Then we have intellectual difficulty or disability, where cognitive, motor, and behavioral issues. It makes it really difficult for them to comprehend what social expectations are. So, a child with severe to profound mental retardation or intellectual difficulty or disability would not even know how to communicate that they want to go to the bathroom, and they will not even recognize that we are outside the house, because that labeling and matching skills in their brain are not really appropriate level. So they're not able to comprehend social behaviors. They would probably just mirror your behavior. So if you go and touch an elder's feet, they would probably mimic that A to Z, everything the same. But they wouldn't know why we did it, and they would not even remember to do it again. This is not like a general thing that happens across um, every special needs or every diagnosis that I have discussed right now. um, no two children are the same. So I'm just overall touching upon how social development is compromised in various disorders and special needs. All right, fun part, my part. Working on a child's social development is of the utmost importance, and it is so much fun. um, and it's fun because you have to do it again and again, and the parents don't have an agenda. So we as therapists, we tend to not have that amount of pressure that this has to come. Parents have a very fixed thing in their mind that communication needs to come. बात कर लेना चाहिए मेरा बच्चा. जब स्कूल के इंटरव्यूज देने जाएगा, फॉर्मल स्कूल के इंटरव्यूज देने जाएगा, तो क्वेश्चंस के आंसर दे देना चाहिए, मेरे लिए उतना ही काफ़ी है. प्री राइटिंग स्किल्स आ जाने चाहिए, बेसिक राइटिंग स्किल्स आ जाने चाहिए, दैट्स मोर देन सफिशिएंट. So academic and communication is something that they're able that they express a pressure towards. And sometimes even with the sensory issues and the meltdown is where they say ki, we don't want them to behave in an XYZ fashion out in the real world. So this is mostly where us therapists have pressures from the parents. I'm not complaining. I really like having that pressure. It feels as though the parents are really well involved, which they really are, and that expression becomes very clear. So this is something that parents, you are neglecting. So please give a little extra emphasis here. So the first thing is that you need to understand your child and their diagnosis. I said this the last time also. I will say this in every webinar of mine that I'm doing about kids. You need to understand your child and their diagnosis. You need to know what the strengths are, what the limitations are. To be able to train a child to work on their limitations using their strength takes a lot of awareness, and you need to be aware of that. So and I'm not just saying that your child is your diagnosis. No, I mentioned that and I have emphasized that your child is beyond the diagnosis, but we need to understand the diagnosis because it sort of brings about a glass ceiling that we know that this is the level where the child is at the most going to reach at, and beyond that if we are expecting, it's an unrealistic expectation. So just for our expectations to be in check, we need to know the strengths and limitations that come with the diagnosis and the child's. For example, a child who has a learning disability, for example, dyslexia, and the child particularly has problems with spellings. We know that the child has a visuospatial deficit. We know that there can be certain comprehension issues when it comes to spellings. It will not be there with grammar, vocabulary, written, and verbal expression. If we are expecting this particular child to not have a spelling error in the science exam, it is an unrealistic expectation. It's very unrealistic. So we need to be very well aware of that because that's something that the child takes on themselves. They internalize it, the insecurities increase, and their social development goes down. You need to start with basic communication, and you need to start with basic communication right now, irrespective of the fact that you had a child yesterday. Please, the basic communication in terms of the eye contact, name call response, snapping your fingers around the child, making different noises, making different faces in front of the child, that is extremely important, irrespective of whether we're working on social development, emotional development, motor development, or whatever. It is extremely important to give the child that physical stimulation. You short, clear, crisp instructions. Now, this is something that a lot of parents and a lot of children struggle with. So the parents would be like, go there, get this from there, and then from there, go there, do this, and then come back to me. Now, this is something that's very complex for the child. So you need to say, drawing room has this, get it. The child will go in the drawing room, pick that thing up, get it for you. And you say, thank you, you got it for me. Great, you appreciate the child. That's it, done. Task two. That's how we're supposed to do. Three different tasks. Instead of jumbling them up, give them one after the other. I mean, what's the worst that can happen? You'll just end up wasting 5 minutes of your life or 5 minutes of the child's life. Excuse me. So that's just 5 minutes of your life and the child's life that's going to get invested, not wasted. Invested into clear communication, and that's the example that you're setting with the child as well. Then, and I cannot stress this enough. No therapist can stress this enough. Use pictures, flashcards, and visual aids. Children with special needs, they tend to comprehend much better if you're speaking in pictures, if you're not forcing them to communicate using words, because a lot of times words become a huge limitation and it makes the child really insecure. So use visual aids. Be patient. If you feel like it's really difficult for you to lose patience, hand over the task to your partner or just leave the task. The task is not as important as your calm and the child's. So be calm, be relaxed. to the best of your abilities. And if there are occasional slip ups, you are a human after all. Avoid saying the word no, and I cannot emphasize this enough. It is as important in a child's emotional development as it is in social development. Now, if you actually look at different warning signs that are out there, traffic warning signs, say no to smoking and things like that, everywhere you will see the word no. And what the word no does, it confuses us. Now it says no smoking, and I'm not a smoker. I'll be like, this is not for me. I'm just going to chuck it. Then there are going to be people who are going to be smokers. They're going to look at no smoking and they're like, I'm a smoker. I mean, this is not for me. This is for people who are not smokers. That you don't start smoking. And they would actually stand under the no smoking sign and start smoking. The word no is something that a brain tends to take it with a pinch of salt. You tell yourself, I don't want to eat a chocolate, and your body will start craving a chocolate. I don't want to eat junk food, your body will actually start eating junk food, crave junk food. So, no is something that pulls our social and emotional behavior and development to a previous level. So if you tell a child, no, you're not getting a chocolate, socially they'll start behaving like a little kid. A 10-year-old, if they're told that, I'm taking you tell them that no phone from you from today. You snatch their phone, they'll start behaving like a toddler throwing a full-blown temper tantrum, a 10-year-old throwing a full-blown temper tantrum. So social development is pretty primitive, and that insecurity comes about. Use modeling and mirroring as techniques. Cannot stress this enough. Modeling and mirroring as parents, it goes a long, long way. Who you are today as parents, your children are going to be the same or similar kind of people in the future if you're the right role model. If you're not the right role model, your kids will be the opposite of their parents. So it's extremely important to model and mirror behaviors that you want to see in them. So if socially you want to see them touching the elder's feet, that's exactly what you start from today. Acknowledge and praise. As soon as the child shows an expected social behavior, acknowledge and praise. For example, I remember this little kid who would come to me a few years ago. He had a lot of social anxiety, and it became extremely difficult for the child to be able to sing out a nursery rhyme in front of his own family members if there were more than two of them. So, if, for example, both the grandparents and the parents are sitting, the kid would not be able to, you know, say the nursery rhyme, recite it. And he had a lot of anxiety, and every time four of them would sit together, even at the dinner table, he would start getting very anxious and panicky. So how we started working was, we first started working on the child's body. That listen, first we learn how to deep breathe, and I put a little toy on his stomach, and I said, this toy needs to rise and fall. That's called deep breathing. And the toy wouldn't rise and fall because it was on the stomach and not on the chest. And then I tried to make him see from his perspective while he's lying down. And he tried real hard till about the third or the fourth session. He was able to breathe deeply, and the stomach would rise and fall. And that's when, the anxiety started coming a little bit down because we were working on the body. And that's when we started step two, is working on the behavior. And how we actually did it is, we used modeling, mirroring, along with acknowledge and praise. So, and play therapy as well. I mean, play therapy is my brahmastra. I'm always going to use that. I'll never stop using it. So what we did was, all five of them, they were made to sit together in a circle in the session. and the five of them, and I was the sixth one. So I had the first chance, and I had to recite a nursery rhyme. And I recited a nursery rhyme, and I made sure I said it incorrectly. And everybody was looking at me, and I looked nervous. And the kid is like, "Ma'am, breathing, ma'am, breathing." So that's where, in my mind, I knew that the kid had that understanding that socially I don't have to get awkward. I have to start working on your body, on my body. And then everybody started clapping. Very good, koi baat nahi. 90% of it was correct, 10% was incorrect, no problem. Here's the nursery rhyme. You revise and you say it again. Second chance also given to you. And so on and so forth. We would go around, and after me, then the third or the fourth person fumbled again, and this was all staged just to get the child over their that internal anxiety of, I don't know what's going to happen if I speak it wrongly. How will they criticize me? Oh my god, to what extent? What if they don't like me? And that's something that, is a special need, that the child is experiencing anxiety, that the child in that moment needs to learn how to calm down, and not every child would need to learn how to do that. So I think it took about 10 to 12 sessions for us to be able to work through all of that. And today, I think he's about 7 years old today. And I got a call, I think on in September on Teachers Day, where I talked to him for about good 1 hour, and this guy wouldn't stop talking, and I was filled with so much, pride that I am one of his first teachers, and at the same time, I was so happy, and it was so rewarding that we acknowledged the child's efforts, and it's gone to the point where in the 3 years that he's come so far, is that he's able to do things without experiencing that debilitating level of anxiety. Because granted, you, me, everybody, we experience anxiety on a regular basis. We just, shove it outside our consciousness. I don't want to think about it. But this guy who's 4 years when he first came to me, now he's 7, and he's worked through it. So a really good example and a motivation, inspiration for all of us. Then shaping and chaining using task analysis. And I know this looks very technical. Task analysis is basically break down a particular behavior into small little parts. Something as simple as brushing your teeth consists about good 10 to 12 steps. So every time a child takes that particular step, you shape and you chain. So what do? If the child just puts the finger in the mouth like this, you acknowledge, you praise. Oh wow, you put a finger like this. Now the next time they're in the bathroom, you put a finger like this. No, we'll put toothpaste here and then we'll put the finger like this. And the child starts getting warmed up towards the idea of brushing their teeth. So what you have done is you've shaped a behavior. You've reinforced a behavior which is similar to the desired behavior you want to see. And then we chain it. So after they do this, then we get the child to do a little bit of this on the inside with the toothpaste on. So you've chained. One behavior is chained to this one. So two behaviors you've linked together. That this is one aspect or one part of brushing. This is what you've done, shaping and chaining using task analysis. If there's any doubt about this, I will take it up. If you want me to explain it again, I will. Just let me know in the chat box. Then prompting. Again, prompting is such an underrated technique where and this works really well when you're working on a child's social communication. Um, so for prompting, a lot of times when I'm working with children on the autism spectrum, they are pretty lazy, huh? Hyperactive but very lazy. And I'm not saying this as a generalization, just an observation about the kids that I have worked with. So yeah, so coming back to pretty lazy. So they, even though they know how to speak in proper full sentences, they would not, because they like the attention that comes with the prompt. So there was one particular kid that I was working with 3 4 years ago, and every time I would ask, "What is your name?" he would say, "So and so." So first name and second name, and then I have to prompt him, "Pura bolo." So he would be like, "My name is so and so," and I would have to do it practically every session, and he would really enjoy getting that attention from me, and he'd be like, "ये पूरा नहीं बोला मैंने पहले." And so this is something where that social relationship between the therapist also gets fostered, and we are able to do it only when we are patient. We know for a fact that the child has acquired that social skill. The child is just pulling my leg. He's exhibiting another social skill of humor, and it's okay. You accept it as long as it's not taking advantage of me as a therapist. It's fine. It's good enough. Then assisted behavior training. So assisted behavior training is again technical words. This is something that I'm very sure most of you parents have done. Is if they want to hold a pen, you put, whenever they're writing rather, you put your hand over it and you make the child write. That's assisted behavior training. So if they want to pick something up, you put your hand over it and then you make them pick it up. So that tends to help with social skills as well. Again, that also uses modeling and mirroring. Or sometimes it can just be like a physical prompt that helps them do the assisted behavior. It could just be like this, and then they say, "Oh, hi, hello." So then you also reward chance behavior. And again, I'm gonna give a beautiful example, which is one of my happiest memories till today. So there's this kid that I was working with some years back, and he was 2.5 at the time that he came, and his first words were Nishtha, and it brings me a lot of happiness that his first words were that. But honestly, I made sure his first word was my name. And so what I did was, whatever, every time he would say anything close to Nishtha, I would reward it. And how would I reward? He really loved Bonvita biscuits. And I don't use edibles in my sessions at all. So what I would do is I would always have a wrapper of Bonvita biscuits, empty wrapper, and I would just give it to him to play with and fidget with, and he would like make sounds and he'd be happy. Initially, he started crying that you're just giving me a plain wrapper and you're not giving me biscuits, but you're not supposed to give a child edible till the time it's really necessary. So over the course of 6 7 months, his first clear word was Nishtha, and yeah, so that's something that we were able to achieve. So every time he would want to call me, he would call me Nishtha. So like a 3 year old calling 27-year-old Nishtha. So that was really something that I cherish very deeply. Then use reinforcement. Here we did use reinforcement. We did not use the Bonvita biscuit, but the wrapper. Again, creativity is extremely beneficial in bringing about any intervention when we are working with a child's development. And last but not the least, practice trials. I'm someone who advocates practice trials even in your sleep. Conversational skills when you're working with a child, turn taking when you're working with them. If you're trying to teach them the social skill of sportsmanship and leadership, you can teach practically everything under the sun using practice trials. Two teams, you make the child sit very close to you, so you and the child are in the same team. The opposite team is maybe the other parent or a sibling or any other person. They would ask a question and you would prompt in the child's ears that this is the answer, and the child would answer. And then Following question will come from the other side, and then you again prompt. Slowly and steadily, you'll realize that the child starts doing it on their own. Now, if you're using practice trials by themselves, they may not be as beneficial. So you will have to again use the above techniques with them as well. So every time the kid says, let's suppose the first half themselves, and then you have to prompt them the second half. So for the first half, you go like, yeah, you just from their head, you go like, yeah, very good. And this is the rest of the answer. And you say the rest of the answer. So it'll have to work in conjunction with other methods as well for it to be very effective. Reinforcement works, prompting works, acknowledging, praising works, modeling, mirroring works together with practice trials. And the beauty of practice trials as a technique is it is so dynamic that you can actually try it with n number of techniques. You can even try it with occupational therapy and train the child to do their own occupational therapy exercises. Is something I've also done in my career. So yeah, I think yeah, that's thank you. I've covered most of the content. Any questions, anything, please feel free to ask. Another thing is that we don't have too much time because I
Yes. There is a repeating question like throw more light on shaping and chaining. You have explained. Back to other questions.
yeah, okay, yeah. So shaping and chaining, great, thank you. So who has asked this question? Can you unmute yourself, please? Any one person who has asked this question, unmute and ask the question specifically.
Madam, this is Shantaram. So I mean, I missed some part due to some internet connection there. So I
Oh,
want to know more details on the shaping and chaining task analysis because all
all
I
right.
understand.
Okay. So, is there any particular behavior or any particular social skill that you have in mind that you want to use this technique for? I can use your example to explain it to everyone else. Anyone has any example of any social skill or social behavior that they want to teach their child? They can unmute themselves and I'll use the same example to explain.
Yeah, hello.
Hello.
Hi.
Yeah.
Yes, this is Velu here.
Yes.
Actually, my son has he's quite often he used to laugh the social behavior without any funny moment or any
Hmm.
large reason behind that.
Hmm.
He developed the habit of laughing himself.
Hmm. Hmm.
So that is what we are trying to correct from as a parent. So is there
Okay.
any technique or any thing which can help him to make him calm down without any logical or any
Hmm.
funny moments, without
Okay.
any reason? He shouldn't be laugh frequently.
Hmm.
Is there any idea?
Yeah. I'll answer your question. Just give me a minute. Okay. So I will use another example. I'll use my own to explain shaping and chaining, and then we'll go and answer your question. I
So
hope that's all right.
I have one more. I mean, I don't know if you can use it as an example for
Sure.
shaping and training. We are
Sure.
trying to teach our daughter to ask us questions.
Hmm.
We have taught her to answer questions, but now
Hmm.
we want her to ask us, like,
Hmm.
mommy, what are you doing, and
Hmm.
things.
Okay, great. Yes, thank you. I can use this as an example. So, when it comes to you asking her, you expressing the expectation that I want you to ask me questions. So, here, what you can do is first and foremost thing is break the entire thing down. So asking questions is something that's a conversation starter. So what you can do is one is actually write those words down and jumble them up, and then put the flashcards in front of her and ask her to read if they can. So the shaping bit will be getting them to read the first word. How. Every time the child says the word how, you reward. Every time the child says the word why, you reward. Every time the child says the word where, you reward. Or even if they make that particular sound, you reward. And then you go to the second word, then you start rewarding that. So that is shaping. And when you make the child join two words and then you're rewarding those two words, that will become chaining. So shaping will be, you are breaking it down to the smallest of possible behavior or skill, get and rewarding the child at even the slightest chance, out of context chance. You rewarding the child with praise, rewarding the child with attention, rewarding the child with kisses. And then when you chain two behaviors together, even if it is something that's an action of this, if you're rewarding this also comes under shaping and chaining. I hope that's clear now. If it's not, please put it in the chat box. I'll explain it again. Going to your question about teaching your child how to keep their laughing to the bare minimum, or completely not be laughing in inappropriate or social settings, use flashcards. Train the child that this is what the flashcard means. So what the flashcard means is you have to sit like this. So the child will, in a social setup, even if the child is laughing, the child is sitting like this. So slowly and steadily, the society also becomes mindful of the fact that the society also becomes mindful of the fact that the child is trying, and they become a little more supportive as well. So I hope that answers your question. If you're able to not, if you're not able to, rather be able to, sorry, it's just few people being unmuted and that's distracting. If you're not able to train them to be able not laugh in inappropriate times, get back to me, and we'll come up with a social skills training plan for them.
The next question is from Sita. Can you please tell us how we can use play therapy with our children?
Ma'am, such a generic question. A little bit narrowed down question. With our children, okay, you can use play therapy, like I said in the last webinar, and that's like one of the things that I stand by in my life. You can use play therapy with anybody. You can use it with somebody who's 80 years old. You can use it with someone who's 8 months old. How to use play therapy is, first and foremost, identify what you're trying to do with play therapy. Are you trying to get your child to learn something? Are you trying to work on the child's development? Are you trying to work on the child's communication? Once you have that down, try again to do a task analysis. Break it down to the closest, simplest, smallest thing that the child is maybe already doing. And in play, maybe reward them, give them attention, acknowledge them. So using different toys, maybe you can teach feeding to a doll, or feeding to a toy, and get the child to feed themselves as well. So I hope that answers your question.
Yes, ma'am. On a broad level, yes. Just one addendum to that. Do you think that as parents we should undergo some kind of a play therapy session? Because sometimes we just run out of ideas on how to play. We're just running around so many things in a day. So, to be creative and play with the child is frankly very difficult for me. So, do you think we should attend some course on that, or a short webinar?
Honestly, course I would not suggest, because it's an intensive training.
Okay.
And it is something that's beneficial for therapists if you're planning to be a therapist for other children as well. That's a great idea. But yes, if you're looking for like a short webinar, maybe we can try and set that up. And I feel that yes, parents, irrespective of their age or age gap with their children, must be able to play with their children at their child's level, because it's, you know, it's really difficult for a growing child, irrespective of the fact that whether they're neurotypical or they have special needs, they are not able to match their parents level. So it's extremely important for the parents to come down to the child's level. For that, play is a beautiful tool.
Okay.
Play, art, music, dance, beautiful tools.
Okay. Okay. Ma'am, it would be great if we can have a webinar, just like a refresher to learn how to play.
Done.
Thank you.
Yes, that's
Ashanti
great.
ma'am, done.
Yes, yes, we'll do it. I mean, next we'll take it up.
Thank you so much, ma'am.
Most welcome.
Okay, next question from Bhulakshmi. If the child becomes aggressive when he becomes anxious, how does modeling help in reducing this?
I am assuming Bhulakshmi ma'am has not watched my, has not attended or watched my previous webinar. Ma'am, please do that. This question answer I have answered in the previous one. This is more to do with emotional regulation rather than social development. For aggression, you need to first be very well aware of where the aggression is coming from, and where the anxiety is coming from. Teach the child appropriate coping methods from when it comes to their aggression and their anxiety, and that will not ideally hinder their social development. So the how to teach them is something that you can ask me personally, or you can refer to the previous webinar. I have explained that at length there.
Okay, I'll take some general questions,
Hmm.
very specific, but still it's like my son is 18 and he's not able to socialize, has no friends. Who do I approach for help? I mean, generally I've seen these problems in,
Okay, perfect.
yeah.
Amazing question. I don't know whether you're a ma'am or a sir, so I will just refer to you as you. Firstly, does your child have a diagnosis? And I call them a child even though they're 18. Do they have a diagnosis? If they have a diagnosis, then we go to specific therapists. If they don't have a diagnosis, a psychotherapist or a child psychologist or a psychologist in general that specializes with maybe anxiety or maybe behavioral issues of children can handle this. If you want to talk to me personally, I can help out very well in this particular case.
The thing is, ma'am, like he is not able to, he makes friends, but he is not able to keep his friends.
Is there a diagnosis involved?
No, he had ADHD when he was in school. Now he's doing his senior secondary in NIOS. And I've taken
Which type of ADHD?
uh,
Inattentive, combined, hyperactive, impulsive type.
attentive.
Inattentive.
Yeah.
Then this is a behavioral issue. This is nothing to do with their diagnosis, although I'll have to interact with the child once to be able to ascertain that. Does this child have anxiety?
Yeah, and
Do they
he's
get scared easily?
always depressed.
Biting nails?
Yes.
Frequent nightmares?
Uh,
Bedwetting in childhood after toilet training?
no, no, no.
Biting nails is happening?
Yes, ma'am.
Anxiety. Most likely anxiety.
Uh,
Anxiety and maybe lack of self-confidence. And if
yeah.
you're saying depression and symptoms of that is there as well, so then self-confidence needs to be worked on.
Okay. So how do I contact you, ma'am?
I will put my number in the chat box. You can contact me there. WhatsApp.
Yeah.
All right.
Nishtha ma'am is in our Telegram group also.
Yes, I am there.
Telegram group of SNIC Rehab Foundation. So, and also she is there in our psychological support group on WhatsApp. You can ping me, I'll add you both.
All right. I'm sorry, but we just have 10 minutes.
Yes.
I have an important session after that at 8 o'clock.
Play becomes repeated and isn't social when with other children. How to involve him with other kids? Anand.
Group therapy is your answer, and I understand that it's COVID times, group therapy is not possible. But when it comes to getting children to socialize, group therapy is one of the most amazing things. Having said that, you can try and doing practice trials, try to get the child involved socially in a group consisting of the family members that are already there, or maybe one or two close relatives if you all have been vaccinated or have had antibodies or whatever. Just get a few more people there, start playing something that's at the child's age and mental level, and the child should pick it up. Increase their social interaction if the child is not anxious. If the child is anxious or social interactions, please do not increase their social interactions without working on their anxiety. It's my humble request. We'll end up doing more good than we'll end up doing, sorry, more harm than good.
Next question I'll take quickly. How do we develop social greetings by way of shaping and chaining?
Social greetings is something that you can develop using modeling quite a lot. Modeling, acknowledgement, and praise works better in teaching how to greet rather than shaping and chaining. Shaping and chaining usually works for complex social skills, not for something that's very simple to execute. Doing hi, hello, handshake, namaste.
I'm just looking for generalized questions if we have anything. No, other questions are all are like specific to their kids. So I can allow to unmute someone who has generalized question not specific to their child.
If
Yeah.
if there are specific kid related questions, you can ask me in the Telegram or the WhatsApp group. I'll
Yes.
answer.
Okay, Spruti Bangla, do you have question, generalized question? Then you can ask.
Hi, ma'am. This
Hello.
is first time I am going through your webinar, so please be sorry if I ask some question
That's okay.
unknowingly that you have answered earlier.
No problem.
Okay, I can make it as a generalized question because I went through questions which has been asked for you to you. It is related to children who are non-verbal. Okay, so when the child is non-verbal, it becomes for a parent very difficult. Provided, suppose if a child is non-verbal, provided he's visually very good, okay, but when I make very short, crispy questions, not exactly questions to make him understand, the child is not interested in doing it. Basically, like how to teach a non-verbal child to accept the questions, follow the instruction, and respond to whatever way they want to respond, like any way of communication.
Oh, I think she lost her connection.
Yes, even I feel that.
Yeah, actually, she has another session in 5 minutes, so I'll just get back if.
Yes, please.
Yeah. Parent, she's just logging back, but you have requested, lot of parents are requested to get added in psychological group. Can you just send all the requests to my WhatsApp so I can send you the links, or just let me. Parents, just send me request on WhatsApp. It will be easier for me to add you there. Please WhatsApp me on this number. 9422276105.
Hello? Can you hear me?
Yes, yes. Can you?
Sorry, I don't know, something happened with the network. Yeah, sorry, I got disconnected. Yeah, so what I wanted to ask first and foremost is, are you aware of the child's diagnosis? So you're saying they're non-verbal. Is there a diagnosis that you're aware of with the child? Okay. I'm just going to say whatever
Hi. Actually, she didn't unmute me, so that's the reason I was trying to talk to you. Yeah, I am going through the diagnosis right now for my son.
Okay.
On a basic, this thing he is under mild autistic, and there is a developmental milestone delay. Whereas all the milestones which has got delayed, it is somewhat coming up. It is taking time, but it is coming up. And provided I'm a very active mother, whatever possible I try to do at home. Whatever I learn from therapies, I try to do at home. I believe in repeating everything and understanding and repeating it at home. And it requires a lot of time to be diverted towards the child. But as all the parents ask, there are children who are missing with the milestones. They are non-verbal child. It becomes extremely difficult to. Probably they might be very good in visually. They are listening every instruction, but they don't know the formulating to how to answer that instruction, and what is the important of that instruction. Why am I being asked a question? Why am I they are asking me to pinpoint here or there? What is the need?
I completely I get your point. So basically what my suggestion is that first you go through the diagnosis. Secondly, you are saying that there is a global developmental delay. So we need to be very mindful of the fact that this child may not be able to comprehend what you're saying right now.
Okay.
He or she may not be able to understand what you're trying to say. So maybe for something like this, try doing assisted behavior to teach them.
Okay.
So try doing that and let me know how it goes like.
What exactly is the assistant behavior? Can you emphasize?
Get the child, you assist the child in doing things. It's their hand, it's their body that does the thing, but you sort of help them. You pick, you touch them and you get them to do a certain behavior.
Okay.
Okay. Let me know how it is.
Okay.
Okay. Thank you, everyone.
Thank you.
I'm really sorry. I have to leave. If there's anything else, you can, take my number either from Harshali ma'am. I'm there in the Telegram group and in the WhatsApp group. Feel free to send me a personal message and I'll help out to the best of my ability. Thank you so much for being a lovely and an interactive audience. I really appreciate it.
Ma'am, Nishtha ma'am, I just have my son 16 years old and ma'am वो क्या करता है, गाने सुनता है और जैसे क्वेश्चंस के आंसर लिखता है तो भी वो गाना सुनता ही जाता है.
मैम आप मेरे को प्लीज मैसेज करेंगे पर्सनल पे। मैं
Okay.
एक्चुअली मेरा
I'm
ना 8
sorry.
बजे सेशन है। आई एम सॉरी हाँ।
No.
आप मुझे
Sorry,
मैसेज कर दो।
very sorry, ma'am.
नहीं नहीं दैट्स ओके कोई बात नहीं। आप प्लीज मुझे मैसेज करना। हाँ
जी.
Okay.
Thank you, Harshali ma'am. Thank you, ma'am. Thank you.
So much, Nishtha, and this is the one
you.
info. Think you can connect with me or Nishtha ma'am or on Telegram and WhatsApp. She has to go. Thank you, parents, and thank you, everyone.
Thank you. Bye bye. Take care. Have a great weekend. Happy Holi. Bye.
Yes, happy Holi to you too.
Thank you. Bye.
Thank you. Bye bye. Good night, everyone.
Good night.